I'll be discussing wound care today. The first thing I want to do is administer pain medication to your patient half an hour beforehand, so they're not in any pain while you're doing the procedure. Then you're going to gather your supplies, which I have here now. You'll have a waterproof pad, and you're going to apply PPE, so gown, gloves, mask if necessary. Then you're going to perform hand hygiene. You put on your gloves, so you can dispose of the soil dressing. So to do that, you're going to lift up the pieces of tape on either side of the dressing, and then you're going to pull it up from the middle, so you're not pulling on the wound. And then I guess I can leave these gloves on. To measure, you're going to have your tool here. You never want to touch the wound, you're going to directly hover above it. So I'm going to use the centimeters here. So width, you're going to measure hip to hip, so from side to side. This one's about 2 centimeters, and then for a length, it's head to toe. It's about 4 centimeters. Put that here. Then I'm going to get a sterile Q-tip. To measure and assess the tunneling. So I'm going to insert this sterile Q-tip into the wound, and then pull it out and mark where it ends, and then measure that with my tool. And then I would document the tunneling. Also, when you're assessing the tunneling, you're going to assess them. The patient's head represents the 12 o'clock mark, and the feet represent the 6 o'clock mark. And then after that is finished, you'll remove your gloves, and you can irrigate. I have a Toomey syringe. In the real world for this video, we have a small one. So I'll draw up my saline. Then I'm going to have an emesis basin below the patient's wound, also a waterproof pad. And then I'm going to start at the top, and I'm going to work my way down, going from side to side, letting the drainage come down into my container. I'm going to continue doing this until the drainage runs clear. So that's that. And then you're going to pat the skin dry with your gauze, and then you're going to dispose of all your old equipment. Wash your hands again. And then to get a culture, you would have, there we go. Lost my culture tube. You would have your culture tube. You pull out your swabs, and then you're going to insert them into the red granulated tissue, not anything else. And you're going to pull this out, and trying your best not to touch the surrounding of the tube. You're going to insert it down and you're going to put the cap on until it clicks, or you're going to break the ampule. And you're going to mark that with the patient's name, their date of birth, the date, where the wound culture is coming from, and you're going to send it down to lab. And then you're going to do your wet to dry dressing. So I get my sterile kit. So equally move the patient towards the patient, towards me. And then grab my sterile gloves. Applied one sterile glove to my dominant hand. I'm going to come over here to my kit, and I'm going to move this closer to the edge since it's sterile. Then I'm going to take my supplies and move them over here. And then with my non-dominant hand, I'm going to put my salmon into a container. Then I'm going to get my gauze, and I've got quite a few pieces here. I'm going to put them in my saline for the wet part. And then I'm going to apply my other stick. So I'll come back over here. Keeping my hands up. And then in here. Okay, then I pick up my wet gauze and I would squeeze out excess moisture. And then I grab my forceps here. So I'm going to stick the gauze into my hand, and I could use one of my sticks here to push it down. So like this. You want to not touch the patient's skin. Then you would pack the gauze in there. Make sure not to overpack it. And then you're going to cover the wound with an ABD pad, so like this. This one's a little bit oversized, you can't tell. I'm going to place that over the wound. And then with my Montgomery strap, which I made beforehand, I'll grab that. I would have several. Going to put the sticky part on the patient's skin. So I'll do it on this side. And I'd have one on the other side of the wound. And then this is going to go on the top, over the top. Then I would get some string. And I'm going to run this through the hole I created in the Montgomery strap and thread it through the other side, like so. And then tie it off to the side. After that's finished, I would perform hand hygiene and document my procedure.